Alright. I think we're live. I
We are
think this is
live.
it. I think so. Hey, Adrian.
We're
So
here.
this is right. We did it. So listen, I am so excited. You guys know I love to show up on Fridays. First, it's Friday. Who doesn't love a good Friday? Right? As long as things
Absolutely.
are good, right? And so, oh gosh, you know what? I just got a thing that says we're having trouble here. Oh, all right. We're
Getting a
gonna
little
leave it alone.
delay.
Yeah, something crazy. Anyway, I'm gonna ignore it. I hope that it's not a serious issue. We'll let it go. Um, so anyway, it's Friday. I love to hang out on Fridays. As you know, Friday friends. Like I love to share my friends with the world because I think maybe a little bit biasly, but I think I have the best friends in the world. And they're really awesome and they do some really neat work. And today is no exception. I have my friend Adriane Carrier here with me, Nurse Adriane RN, in some of her other platforms. I'm going to let her talk in just a minute, but I do want to let you know that Adrienne is really a dedicated advocate for social justice and health equality, and she's committed to making a positive impact on people's lives. And this commitment has really led her to become an RN in Southern California, where she's provided care to underserved populations. She owns and operates Trusted Guardian Patient Advocates, which we're going to talk about more today, which where she offers comprehensive services, private concierge, patient advocacy, health coaching, clinical navigation, on and on and on. And I don't want to forget to say that she and I actually met through Pulse Center for Patient Safety. So there's a ton of stuff going on there, Adrienne. Welcome. Thank you so much for hanging out with me today. You know, I want to say we talk a lot in the circle about showing up no matter what.
Right.
And Adrienne, thank you. This is like the second time you've showed up in my world against odds. So thank you so much. I just want to say that first and foremost. How are you today?
Welcome. Thank you so much. Yeah. Well, it may, I thought, well, I'm not going to make a correlation here to, events that are become challenges or obstacles, but, we persevere and that's what we do. I'm an RN and we push through, and that's my training is just to push through. It's kind of like the military, but I'm great. Thank you so much, and I appreciate you being, inviting me here. And yeah, we met through Pulse, and which is a very dynamic organization that's brought a lot of patient advocates together. And I'm on the board of directors, and so check that out. And right at the get go, I want everybody to hit that like button, subscribe to both of our channels, and let us know what you know about patient advocacy and your own experience about being a patient or being an advocate of some kind. So yeah, so I started this company. It was just really a synthesis trajectory of my skills, my background, my passion, and wanting I say freedom to be an entrepreneur, but that can be an oxymoron because being an entrepreneur is extremely hard. It's a lot of hats you're wearing. You're doing a lot of different roles. And people say, "Oh, how's the business going? I see you doing this, this, this." And and those of us who've started businesses, and this is my third company, is you don't start the company, advertise and then have customers and just you're not like sliding the card through the first day, right?
Right?
Unless you've got, I don't know, some diet pill or something, I don't know, but unless you're pouring tons and tons of
Yeah, I
money
know.
into advertising. But I'm not doing that. I'm really doing organic, and like many of us are, right? And we're learning along the
Right.
way. So as an entrepreneur, I just want to encourage people to take that risk and don't be afraid of failing. Like failing is just part of it. I just recently pretty much rebuilt my whole company and my model and programs, and I'm really producing more marketing material, niching in. So yeah, so and you can find me on social all the social medias, except I'm not on Threads yet. I just can't really add one more thing. Don't make me go to Threads. I can't do it.
All right.
Yeah, I can barely hang on to
Yes,
Instagram,
yes.
but I have a
Right.
Facebook group and I'm on YouTube, and yeah, and you can find me on TikTok. That's where most of my videos, short form videos, are housed. So yeah, so I basically do clinical support. I mean, that's clinical decision support. That's my background as a nurse, and also regulatory compliance, which I thank you, Nicole. I've learned a lot from you, and my background is somewhat in regulatory control as far as licensing of agencies, licensing of nursing homes, hospitals, skilled nursing, LTACs, that arena, licensing of providers in each state. And so that's something that's a little different. So I bring a different set of questions to my clients and to the public. And if you watch my videos on TikTok or YouTube, you'll see that most people don't think about. They don't think about, ask your nurse how many patients they have. Ask your nurse, if you're in the hospital, are they the charge nurse? Or if you find out they're the charge nurse, don't accept that. Ring the buzzer, call the VP of nursing. This is unacceptable. It's dangerous. I covered a video about a Kentucky situation that recently happened with a nurse who was charged with 3 patients in the ICU, and it's a recipe for disaster. And it's just staffing is a patient care issue. So my goal is to really bridge that gap of what's going on the staffing, healthcare worker side of things to the patient population, and bridge that, hey, staffing and how workers are treated, the fact we have this, shortage of people. I'll say it's a shortage of people willing to work under the current conditions. That is a patient safety issue. It's a massive patient safety issue.
It is. It really is.
Providers leaving states, not enough providers, whether it's doctors, nurses, healthcare centers, folding, there's takeovers happening. In some states, you have to go to another state to get to a level 1 trauma center. And so, or, there may be 2 pediatric cardiac surgeons in the entire state, which is the case of Louisiana right now. And because of a lot of things going on, and, my focus is really to help people make the best decisions and feel confident about the decisions that they're making, and get over the anxiety and the stress. And because we go to the doctors, we all do it. I do it too. We walk out, oh my God, I forgot this, this, and that. Or, I gave my doctor recently a list of all my medications. Well, I'm not over his shoulder looking at what he's putting in the computer. He's confirming. I confirm, with his tech. Sure. I go, to the pharmacy, and half the prescriptions are filled. The other half just never were put in. And, and then this is a provider that nobody answers the phone. So, these are things where we all need that reminder and support, or we're either pressed for time, we're pressed for knowledge, we're pressed for energy and emotional, mental resources, often when dealing with a new diagnosis or exacerbation of a chronic illness. So that's in a nutshell where I come in. I can help with, I also do family mediation, because that's another area, because, I don't know what other kind of things happen in life that bring out the worst and the best out of family members, and family members out of the blue that nobody's seen for years, that want to have input. Or there's just no hierarchy. We're not raising kids and our families and saying, here's the hierarchy of decision making. Nobody's doing that, right? And so I like to invite people to consider that are watching this. What is your hierarchy of decision making within your family or social structure? Maybe you are one of the 20%, no kids aging alone, right? Solo agers. So your decision makers may be, non-family individuals. So it's just important to think about that and make all that really clear. And so that there's no, maybe people may not agree when push comes to shove, but at least there's some documentation or record of it. Yeah, I've taught, this is who my decision maker, because maybe it's not going to be your oldest child. Maybe it's not going to be your spouse. Maybe it's not going to be your only living relative, who might be some distant person you've never heard of, but that's who the hospital finds out about and calls. When in reality, you want to have your best friend or somebody else, or you want to hire somebody to make that decision. So, yeah.
Oh, it's crazy. Especially, it's really interesting as you're talking about that. I'm thinking there's a couple of things, Adriane, that I want to talk about with you. One is that whole thing of planning and having the conversations early. And I don't think that we can stress that enough.
Right.
The importance of it, and having those conversations. They're hard conversations, but like we were talking about before we went live, we can do hard things.
Yeah.
And it's hard, but it could be much harder if we don't have,
Yeah,
right? If we don't,
absolutely.
it can, so I think reminders of that cannot be too frequent. Have the
Mhm.
conversations, talk about how you're going to make these decisions. Who do you want involved? All of those good things. And then the second thing that I wanted to talk to you specifically about was more along these regulatory lines. I know that
Mhm.
you recently went to a webinar regarding long-term care and a lot of the changes that are coming down the pike in regards to
Mhm.
skilled nursing facilities. And I would love it if you would kind of share a little bit about what you learned there. I think it's really important, and I think it impacts all of us. It will touch us in one way or another. And I just kind of wanted to talk a little bit about that, if you don't mind.
Sure, sure. Way to go, put me on the spot. Let me see. Let me try and remember all this stuff. So a
No,
lot of
it's
it was
informal. Just share what you remember. It's okay.
usually I remember things. But so for the folks who don't know about this, right? Center for Medicaid Services basically sets the regulations federally for long-term care, whether or not you have private insurance or whether you're under Medicare. They're determining what the regulations of operation are, in addition to whatever your state requires, in which may be
Right.
additional. With long-term care, um, most states kind of go along with what the feds do, and they just recodify in state law what the feds are doing versus hospitals, which can be very different, or outpatient services, which can be very different. So there are, a lot. The big issue that people face is staffing, right? Hey, my grandma's waited 5 hours, or they're, not being changed, or not getting up out of bed to be fed, right? There is a huge staffing crisis going on in long-term care. And so some of those issues are going to be dealt with, are coming down the line, or are anticipated. Some are actually kind of in the works and not totally finalized from what I understand. They could be
Yeah.
now this month. But typically January is when CMS, releases a lot of new changes, or they say, here's what's
Yeah.
going on. I think COVID also informed a lot of the processes. So there's some of the things have to do, just I'm going to give you like a generic
Yeah.
overview. Some of them have to do with penalties that long-term care facilities will face, accountability. I think we're going to see a higher level of accountability to administrators and people that are at the top. I think that there's definitely investigations going on into what's happened. So for folks who, let me back up a little bit, a lot of long-term care facilities, what we call nursing homes, skilled rehabs, have been bought out and folded into these, offshore companies, trust funds, equity funds that are under these
Yeah.
shells of layers. So when you hear about shell companies, this is what's running a lot of long-term care, and you really can't figure out who is the owner, who is responsible. So this is something that CMS, the current administration, is really aggressively taking on. I don't know if there's going to be some massive deregulation, monopoly deregulation going on, but there's definitely going to be some peeling back of those layers, and they're going to require more
Yes.
transparency about who are the owners and operators. Because, I mean, just for an example, this is extreme, but let's just say 5 people pass away due to negligence in one facility, right? So people are going to want to sue. You're going to want to, there's going to be fines, et cetera. But how far up does that actually go? So, it's going beyond even that administrator on site. It's saying, who is the owner and
Right.
operator here of this organization, and who owns that owner operator? And we're going to peel all this
Right.
back and create some accountability. So that's really good news for the public. And, there's
Yeah.
going to be changes on, I think, the number of hours required per patient day. I see that that's going to be changing.
Oh,
I think there's going to
nice.
be some increased standards on types of care, levels of care. What are considered serious penalties is going to be changing, or serious infractions, right? So, just for example, it could be if you don't get fed, right? If you don't have the right food, or let's just say, mom, dad doesn't have teeth, or they're not able to really chew, and what they're getting on a plate is a sandwich with lettuce and a whole apple, right?
Oh,
So I think there's going to be deeper scrutiny, but it is going to require that states, so part of it is also the feds putting a lot of pressure on the
right.
states to increase their regulatory oversight. Because even though, and again, this is, kind of deep diving into how the inner workings of it, the states are the ones that come in and regulate, and they, CMS from afar does have a, have oversight, but the states are the ones that hire, create agencies of oversight and then hire investigators. So what we're seeing is, and part of the issue is that this massive underfunding and understaffing of investigators, regulatory investigators, to actually get out in the field, to just get
Field.
out in the field and see what's going on and lay eyes in these facilities and be able to respond to complaints. So that's, I think that there's going to be more developing on that, on how CMS can support these states and provide guidelines. But that's, a big issue. Like, I know none of us wants to pay taxes, but this is part of where our taxes go,
Yeah.
but there's no state that is, even in California, and I'm in Virginia now, but, there's still it's a backlog. There's a huge backlog,
Yeah.
so it's also about checking credentials, making sure that everybody, the RNs have a real license, that the LVNs have a real license, CNAs, that the trainings are happening, that there's equity, that there's health equity. Also, just even along, ethnic, racial lines, LGBTQ care, all of those things, right, to create an inclusive environment. So, because people are very, when they're in a skilled nursing facility, they're behind the veil. We don't see them as a public. We don't know what's going on, and things
Yep.
can be really bad before it's really known.
Known. That is so true. That is so
Mhm.
true. Thank you so much for sharing that. Really, out of that, I want our viewers to know that there is so much happening.
Yeah.
And one of the roles that we as advocates play is staying as up to date as possible on some of these things as they're changing.
Mhm.
Having been in healthcare for so long, one of the things that we know is the only constant is change,
Right.
right?
Yeah,
And
absolutely.
regulations are changing regularly, and guidance is changing regularly, and standard of cares are, pathways and all of the things, they're changing. And
Mhm.
it's one of the things that as advocates we stay up on. Like, that's what we
Absolutely.
do. That's part of our job, is to stay up to date and in certain areas. And so I just kind of wanted to highlight that that's one of the
Mhm.
areas that we as advocates, we spend time hearing and listening and being aware and knowing what to look for, so that as we're advocating for our patients and families, we have this up-to-date information.
Mhm. I
Because
think the
reading
other
the
thing
Federal
too,
Register is not super fun, right?
it's yeah, and I mean, I'm a policy person. I love reading policy. I love reading I'm into it. So, but the other thing I wanted to mention too is whistleblower protection. Whistleblower protection is so incredibly important in every state and federal. So the CMS, so folks may hear these cases where, somebody's defrauded Center for Medicaid and they've got to pay a big fine back. So those fines are going to increase. They're going to be looking a lot more closely at those, reimbursements, and whistleblower protection laws federally and statewide are so important. So that's another thing, when you're looking at long-term care in whatever state you're in, or you move to a state, it's actually important to figure out, are the people that I'm entrusting to care for my family member, or when I walk into a hospital, or I go into a surgery center, do they have the protection of whistleblower laws
Right,
to protect them, right, from retribution?
right,
Because it's not easy to come forward and step up when you're in a system that is built on lies, and a system that's built on, don't tell anybody that, we're reusing this equipment that should be sterile,
right,
because there's a backlog and it's not even available, but we still want to book
right,
cases, right? So
right.
these are things that
Yeah,
you want to have very, very strong whistleblower protection for sure.
for sure. For sure, for sure. Hey, listen, Adrian, this has been great. I love it. I love to keep these a little bit shorter because I know
Yeah,
everybody's got tons of stuff to do on
absolutely.
Fridays. But this has
Absolutely.
been great. Thank you so much. One more time, anyone that wants to connect with you, what's the best way for them to do that?
The best way is either LinkedIn. You can go to Nurse Adrian RN on LinkedIn, or you can go to tgpatientadvocates.com and you can book from my website. I'm fixing an error that's up there on my link right now, so I'll be doing that in the next 15 minutes. But you can reach me. My phone number is up there on the website, and and
Hey,
catch me on social media. Check out the YouTube. You can also message me on Instagram if that's a method you like. I'm pretty flexible, but the website is the best way to go. Thanks so much, Nicole. Really
awesome.
appreciate this
Thank
time.
you. Thank you. Thank you. And for everybody out there, go have a great week. We'll be back with another friend next Friday. Bye, guys.